In my 30 years as a physician specializing in geriatric medicine and nephrology, I have witnessed countless stories of vibrant lives extended by modern medicine. Yet, I have also seen the devastating, often silent erosion of health caused by a condition many people ignore until it's far too late: chronic kidney disease, CKD. I'm speaking to you today not just as a doctor, but as a concerned advocate for your long-term well-being. Our kidneys, those two bean-shaped organs tucked away in our lower back, are the unsung heroes of our bodies. They are meticulous janitors, filtering about 180 liters of blood every single day, removing waste products, balancing bodily fluids, regulating blood pressure, and even activating vitamin D for bone health. As we age, a gradual decline in kidney function is a natural part of the process. However, this natural decline can be catastrophically accelerated by our lifestyle choices, particularly our diet. The journey from healthy kidneys to kidney failure, or end-stage renal disease, ESRD, is often a slow, insidious path paved with seemingly harmless daily habits. Many of my senior patients arrive in my office shocked by their diagnosis, stating, "But I felt fine, doctor." That is the cruel nature of CKD. It rarely presents symptoms until 80 to 90% of kidney function is already lost. At that point, the options become grim: lifelong dialysis or a kidney transplant. My goal today is to give you the power of prevention. I want to arm you with knowledge that can protect these vital organs. We are going to discuss 7 categories of foods or consumed substances that you must strictly limit, or in some cases, avoid entirely if you wish to preserve your kidney function well into your golden years. This isn't about fear-mongering. It's about empowerment through understanding. Before we dive into the specific foods, we must first understand the primary villains our kidneys fight against every day: excessive sodium, phosphorus, and potassium. Sodium is the most well-known adversary. When you consume too much salt, your body retains water to dilute it. This increases the volume of blood in your bloodstream, forcing your heart to work harder and increasing pressure on the delicate blood vessels throughout your body, including the microscopic filtering units in your kidneys called glomeruli. Over years, this relentless high pressure or hypertension batters and scars these filters, permanently reducing their ability to function. Phosphorus is another mineral that, while essential in small amounts, becomes toxic in excess. Healthy kidneys are adept at filtering out unneeded phosphorus, but when they're overworked or damaged, phosphorus begins to build up in the blood. The body, in its attempt to maintain balance, pulls calcium from your bones to bind with the excess phosphorus. This deadly combination has 2 terrible effects. It weakens your bones, leading to osteoporosis and fractures, and the calcium-phosphorus complexes deposit in your blood vessels, heart, and skin, causing them to harden like stone, a condition called calcification. With this foundational knowledge, let's begin with the first and perhaps most pervasive threat. 1. The sodium overload, processed, packaged, and restaurant foods. If there is one single enemy to kidney health, it is the modern processed food industry. The amount of sodium lurking in our everyday foods is staggering, and it's often in products you wouldn't suspect. This isn't about the salt you sprinkle from a shaker at the dinner table. That accounts for only a small fraction of our intake. The real danger is in the foods prepared for us. Canned goods. Think canned soups, vegetables, and beans. While convenient, they are often submerged in a brine of sodium to preserve them. A single serving of canned chicken noodle soup can contain over 800 milligrams of sodium, more than half the recommended daily amount for someone with high blood pressure. Frozen dinners. These TV dinners are notorious sodium bombs. They are engineered for taste and long shelf life, and salt is the cheapest, most effective tool for that job. It's not uncommon for a single frozen meal to exceed 1,000 milligrams or even 1,500 milligrams of sodium. Deli meats and processed meats, cured meats like ham, bacon, sausages, hot dogs, and even seemingly healthy sliced turkey breast are laden with sodium used in the curing and preserving process. Sauces and condiments. Ketchup, soy sauce, salad dressings. And marinades are concentrated sources of salt. A single tablespoon of soy sauce can pack nearly 1,000 milligrams of sodium. My advice is unequivocal. You must become a vigilant label reader. Look for the nutrition facts panel and check the sodium content. Aim for foods labeled low sodium or no salt added. The most powerful change you can make is to cook your meals from scratch using fresh ingredients. This way, you, and only you, are in control of the salt shaker. 2. The hidden threat. Dark-colored sodas and sugary beverages. I single out dark-colored sodas like colas and root beers for a specific, sinister reason. They contain phosphoric acid. Unlike the organic phosphorus found naturally in foods like nuts and beans, which is only partially absorbed, the phosphoric acid added to soda for that tangy flavor is 100% absorbed by your body. This delivers a massive, immediate phosphorus load that your kidneys must struggle to excrete. Studies have directly linked the consumption of 2 or more colas per day with a significantly higher risk of developing chronic kidney disease. Furthermore, all sugary drinks, including fruit juices with added sugar, contribute to obesity and type 2 diabetes. Diabetes is the #1 cause of kidney failure in the world. High blood sugar acts like a corrosive agent, damaging the tiny blood vessels in the kidneys over time, a condition known as diabetic nephropathy. Trading your soda for water is one of the kindest things you can do for your kidneys. We've covered the overt dangers of sodium-laden processed foods and sugary, phosphate-filled drinks. Now, we must delve into more nuanced territory. The following categories contain items that are often perceived as healthy, but for an aging individual focused on kidney preservation, they pose a significant risk, particularly when consumed in excess or when kidney function has already begun to decline. 3. The protein predicament. Red and processed meats. For decades, a hearty steak or a Sunday roast was seen as the pinnacle of a nourishing meal. While protein is an essential building block for our bodies, the source and quantity matter immensely, especially for our kidneys. When our body metabolizes protein, it creates waste products, primarily urea. It is the kidney's job to filter this urea out of the blood and into the urine. Consuming large quantities of animal protein, particularly red meat, beef, pork, lamb, places a heavy metabolic burden on the kidneys. It's like forcing an old engine to run constantly at its red line. Over time, this high filtration workload, known as hyperfiltration, can stress and damage the nephrons, the filtering units. Furthermore, animal protein is highly acidic, and the kidneys must work overtime to buffer this acid and maintain the body's proper pH balance, adding another layer of strain. Processed meats, as mentioned earlier, carry the double whammy of high sodium and high protein, along with nitrates and other preservatives that have been linked to inflammation and cellular damage. My recommendation is to shift your protein sources. Prioritize lean proteins like fish, rich in anti-inflammatory omega-3 fatty acids, poultry, and especially plant-based proteins like beans, lentils, and tofu. Reducing your overall red meat intake to perhaps once or twice a week can significantly lighten the load on your kidneys. 4. The potassium paradox. Certain healthy high potassium foods. This is by far the most complex point, and it requires careful understanding. For a person with healthy kidneys, potassium is a vital nutrient that helps regulate fluid balance and muscle contractions. However, for a person whose kidney function is already compromised, a state that affects a significant percentage of seniors, often unknowingly, potassium can become deadly. Healthy kidneys are responsible for excreting about 90% of the potassium we consume. When they fail to do so, potassium levels in the blood can rise to dangerous levels. A condition called hyperkalemia. Severe hyperkalemia can interfere with the heart's electrical signals, leading to arrhythmia and even sudden cardiac arrest. Because kidney function declines silently, many older adults are at risk without realizing it. Therefore, it is prudent to be mindful of your intake of foods that are exceptionally high in potassium. This is not a blacklist, but a consume with awareness list. Fruits: bananas, oranges, cantaloupe. Honeydew melon, avocados, and dried fruits like raisins and prunes are all very high in potassium. Vegetables: potatoes, both white and sweet, tomatoes and tomato sauce, spinach, and certain beans are potassium powerhouses. A special note on potatoes: a clever trick my dialysis patients learn is to peel, cube, and boil potatoes in a large amount of water. This process, known as leaching, can remove a significant portion of the potassium. I'm not telling you to stop eating fruits and vegetables. Instead, I am advising you to diversify. Instead of a banana every day, try an apple, low in potassium. Instead of orange juice, have a handful of berries. Being a savvy consumer means understanding that even healthy foods can pose a risk in certain contexts. If you have been diagnosed with CKD, hypertension, or diabetes, you must speak with your doctor or a renal dietitian about your specific potassium limits. 5. The dairy dilemma. Milk, cheese, and yogurt are culturally celebrated for their calcium content, essential for bone health. However, for kidney health, they present a triple threat. They are high in phosphorus, high in potassium, and a source of animal protein. As we've discussed, aging kidneys struggle to clear excess phosphorus and potassium. While calcium is good, the high phosphorus content in dairy can disrupt the delicate calcium-phosphorus balance in the body, potentially harming bones more than helping them when kidney function is poor. If you're a heavy consumer of dairy, it may be time to moderate your intake. Consider alternatives like rice milk or almond milk. Be sure they are not fortified with phosphates, and discuss your calcium and vitamin D needs with your doctor. They may recommend supplements that provide these nutrients without the added phosphorus and potassium load. 6. The medicine cabinet menace. NSAIDs. This final category isn't food, but it's something millions of people consume daily without a second thought. Non-steroidal anti-inflammatory drugs, or NSAIDs. This includes common over-the-counter pain relievers like ibuprofen, Advil, Motrin, and naproxen, Aleve, as well as prescription-strength versions. These drugs work by blocking enzymes that cause inflammation and pain. Unfortunately, they also block the action of hormones that are crucial for maintaining adequate blood flow to the kidneys. For a young person with healthy kidneys, taking an NSAID for a headache is generally safe. But for an older adult, especially one who may be dehydrated or has underlying high blood pressure, regular NSAID use can be devastating. It can acutely reduce blood flow to the kidneys, causing a sharp decline in function known as acute kidney injury, AKI. Repeated episodes of AKI can lead to permanent scarring and chronic kidney disease. I have seen too many patients develop irreversible kidney failure simply from managing their arthritis pain with daily high doses of ibuprofen. For chronic pain, you must explore safer alternatives with your doctor, such as acetaminophen, Tylenol, in appropriate doses, physical therapy, heat/cold therapy, or other pain management strategies. Please, treat NSAIDs with the respect and caution they deserve. They're not benign. We have walked through a landscape of dietary dangers, identifying 7 key areas that demand your attention. The pervasive sodium in processed foods, the phosphoric acid in dark sodas, the heavy load of red and processed meats, the paradoxical risk of high potassium foods, the phosphorus-rich nature of dairy, and the often underestimated menace of NSAID pain relievers. Avoiding these pitfalls is the single most important defensive strategy you can employ to protect your kidneys as you age. But a life of prevention should not be solely defined by avoidance. It must also be defined by positive, proactive, and joyful choices. The goal is not to live a restricted life of bland food, but to build a new culinary foundation that is both delicious and life-sustaining. The best diet for your kidneys is also the best diet for your heart and your overall health. It's a diet centered on fresh, whole foods that you prepare yourself. Embrace a rainbow of kidney-friendly fruits and vegetables. Apples, berries, cherries, plums, cauliflower, onions, garlic, and red bell peppers are all fantastic choices, packed with antioxidants but lower in potassium. Make water your primary beverage, staying adequately hydrated to help your kidneys flush out toxins. Cook with herbs and spices instead of salt to bring vibrant flavor to your dishes. A squeeze of lemon, a dash of smoked paprika, or a sprinkle of fresh cilantro can transform a meal without adding a single milligram of sodium. A deeper look, the science of kidney decline. To truly motivate these changes, let's look a little deeper at the mechanics of what we are trying to prevent. Your kidney function is measured by a blood test that calculates your estimated glomerular filtration rate, or eGFR. Think of the GFR as the horsepower of your kidney's filtering engine. A young, healthy person has a GFR over 90. As we age, this number naturally drifts downward. Chronic kidney disease is staged based on this number. Stage 3 CKD, a GFR between 30 and 59, is a critical inflection point where complications begin to accelerate and dietary interventions become non-negotiable. Your doctor can easily order this test during your annual physical. I implore you to know your number. The two main drivers of this GFR decline are hypertension and diabetes, a relationship I call the deadly duo. High blood pressure acts like a relentless hammer, pounding against the delicate glomeruli, causing physical damage and scarring over years. High blood sugar, from uncontrolled diabetes, acts like a sticky poison. Sugar molecules attach to proteins in the blood vessels, making them stiff, leaky, and inflamed, leading to a progressive loss of filtration capacity. This is why managing your diet to avoid the 7 items we discussed is so critical. By cutting out excess sodium, you directly combat hypertension. By eliminating sugary drinks and moderating your diet, you help prevent or control diabetes. By reducing your intake of high phosphorus and high protein foods, you decrease the direct workload and toxic buildup that overstresses the kidneys. Every choice is interconnected. The health of your kidneys is inextricably linked to the health of your heart and your entire vascular system. In the end, the power to avoid the dialysis chair rests firmly in your hands, on your fork, and in your grocery cart. Age is a privilege, and your later years should be a time of vitality, not a period of decline managed by machines. I have laid out the warnings and the science not to scare you, but to inspire you. I have seen patients in their 70s and 80s halt the progression of their kidney disease and live full, active lives by making these very changes. It is never too late to start. Protect your silent guardians. They have been working tirelessly for you your entire life. Now, it is your turn to work for them. Begin today.